My name is Tiffany Newville, and I am a gynecologist at a local hospital in an obstetrician and gynecology clinic. My job entails seeing patients for both annual and semi-annual plans. Occasionally, I have to help guide clients to other professionals that can help them with any issues that we found, and sometimes I see my patients more frequently depending on if they have any kind of infections. One of the toughest aspects of my job is probably dealing with fertility issues, such as our patient that we have today. She is a 35-year-old Caucasian woman. She is in the middle socioeconomic class. She struggled with type 1 diabetes, which is the most concern I have given that her diagnosis was polycystic ovarian syndrome, which is the #1 most common fertility issue that I find in my clinic. I have one case about every 70 patients that I get. The most common symptoms are late or missed periods due to a lack of ovulation during the menstrual cycle, and ovarian cysts, and sometimes we do have to treat those further than just medication and exercise. Some of my patients complain of weight gain, loss, or growth of hair, excessive growth, not just like a little bit of hair, because I'd love some more volume to mine, but actual like growth on arms, legs, eyebrows, places you don't really usually get hair. Pelvic pain, headaches, issues with sleeping, and then of course infertility. I commonly, if I do get patients with PCOS, I often ask them to begin an exercise program at least 4 to 5 days a week. I do have a great trainer on hand who's used to working with me and helping my patients to try to overcome this. If that doesn't work, we still continue the exercise, but I'll turn to an anti-diabetic medication or statin. If it's severe, that's when I choose to turn to hormone therapy, but I really try to avoid that unless I absolutely have to. After they are cured, not actually cured, but it does go away, of the polycystic ovarian syndrome, then I usually recommend that to prevent it from coming back, they continue exercising. If they've taken any medication, I do try to wean them off of that, but I ask them to continue exercise as well. Same with hormone therapy. So we'll go back to my patient. I had a patient come in. She's a 35-year-old Caucasian woman. She, as I said, was in middle socioeconomic class. She's diagnosed with PCOS after she was saying she had some issues with her menstrual cycle. She wasn't ovulating properly, so she wasn't having her period. Due to the hospital's protocol, a laparoscopy was performed to check for cysts. We found very few, so it's kind of, it was good to find just in case she's having other problems, but we didn't find very many. We performed a full cervical exam just to rule out any other diagnosis. She was struggling from severe pelvic pain, painful urination, significant weight gain, and fertility issues. And due to this, we had decided PCOS was probably what she had. I did find upon further testing that she had a mild urinary tract infection, which would explain the painful with urination. She will be put on medication for that, and I've asked her to go to the trainer that I have to begin an exercise program. This trainer does have plenty of experience with people with type 1 diabetes, so it's not like she'll just be going in there and hoping for the best. In about 6 weeks, I've asked her to follow up and see where she's at. If the cysts get worse, we will perform surgery upon that, but we really hope that that's our last resort, and we will assess if there's any need for further medical treatment, if we need to start medications or hormone therapy. Unfortunately, there's no way to prevent PCOS, so it's important for everyone experience any kind of symptoms to seek medical help immediately. Just talk to your gynecologist or your regular doctor. Just to try to rule it out. The faster we can catch it, the less severe it gets. It is essential to note that any possible symptoms that they come in with, so if a client comes in and has symptoms, you want to go ahead and start screening for PCOS. You have to realize that not every person is going to experience the same symptoms, and they may not experience symptoms at all, or they may experience symptoms and think it's something else and not go to you, and you won't know. So it's important to always be cautious of that. There is a couple of problems. And healthcare professionals need to be gentle with the diagnosis because sometimes it does, if it's severe enough, will cause permanent infertility due to a lot of damage in the uterus and along the along the ovaries. One of the major issues that needs to be solved is the prevention of PCOS. There is no actual prevention method, so it's just one of those you have to find and screen. So if we could find a prevention technique, or at least a way to reduce the risk, that would be helpful, and then a way to reverse or at least minimize damage caused by PCOS, so that women who go undiagnosed for long periods of time don't have to live with the permanent infertility that comes with it.